Hi, I am David Lee, an acupuncturist. I would like to speak with you about opiate crisis and how acupuncture can be of tremendous help. I personally believe that acupuncture is a very good solution for the opiate and drug crisis of today. What are opiates? They include drugs such as morphine, heroin, fentanyl, OxyContin, oxymorphone, codeine, methadone, Vicodin, and hydromorphone hydrochloride. Other drugs include SSRIs, which are selective serotonin reuptake inhibitors, and benzodiazepines. All of these are not meant to be taken for longer than 3 days to several weeks. So those who take these for longer than 3 to 4 weeks, there's a high likelihood that they'll become dependent on these. The dependence causes a significant economic burden, such as healthcare costs, which go up, unemployment rates also go up, absenteeism from work, and also from school, they go up, and premature mortality. If it's not mortality, then there is a long-term consequence of the damaged body. So it's better to take care of this earlier. And the cost is about, depending on the country, 0.2% to 2.0% of a country's gross domestic product. How does acupuncture work? Acupuncture is a stimulation of trigger points in the skin, resulting in normalization of chemical balance. Simply put, there are sensitive spots on the skin. When you stimulate them, then the chemical balance in the brain magically, because we don't know exactly how that occurs, rebalances itself. So then, you could say it in a different way. Acupuncture taps into the capacity of the body and subconscious mind to self-heal. So you do the A and you get the result B. And the benefits of acupuncture is that you get many, which are less craving, mood swings, less pain, less inflammation, increased focus, clarity, energy, integration, and sense of well-being. So this sounds like a lot. A lot of benefits happen. Actually, that's what happens. That's why we call it holistic medicine. Holistic medicine is multiple benefits at once. And in this case, people do have multiple benefits at once. It's not just for a targeted problem. It targets the body, so the body treats many areas within. And they're all good effects. That's what is another advantage of acupuncture, which is that it meets the gold standard. It's safe and it's effective. How do you know it's safe? Because there is no really any side effect related to this. There's no aggravation, there's no creation of new problems, and also it's highly effective. How do you know? Well, you try it. Your loved friend, family, try it. They'll tell you that this is one of the best things they've done for themselves. And of course, acupuncture has to be done in conjunction with the support of the family and friends and rehabilitative programs. Along with that, acupuncture success will be very, very high. Now, as with the acupuncture, how quickly does that reduce the opiate withdrawal? The withdrawal attacks are significantly less after 3 to 6 acupuncture visits. It could happen after the first treatment, or it could happen after the third treatment. But within 6 treatments, significant amount of people notice an improvement, which is definitely majority. I would assess it as around 80%. And thereafter, they have a weekly improvement. And the total treatment is between 2 to 3 months long. It could be 2 months if it's short. If it's longer, it's about 3 months. So in the first month, they have a lot of improvement, less craving, less cold sweat, less less overthinking the same thing, less desire for the opiates, the benzodiazepine and SSRIs. And overall, the success rate, which would be moderate to high, is at least 80%. So out of 100 people, at least 80 people notice that type of improvement. So I would like this to be as 100% as possible, but when you take the patients who are in a very difficult situation and have them get them out, 80% is a very good success rate. So let's go over the success cases. Case 1 is a male, age 23. He had chronic pain and also opiate addiction because he was into a severe car accident 6 years prior. He had multiple broken bones and he had to have a reconstructive surgery, reattachment of his muscle tendon to another bone, and so on. So he was having chronic all the time pain, very severe, and he had to take medication for that. And of course, because he had to take it for longer than several weeks, he became addicted to them and eventually had to went into taking heroin too. When I saw him, he was being released out of the rehabilitative program, and so but at the time he still was not feeling well. He was only sleeping 2 or 3 hours a night and also in constant pain, was not thinking clearly. With the first treatment, he slept for the whole hour. Now, for not everybody responds this way, but about 40 to 50% notice significant improvement after the first visit or during the first visit. For him, he slept for the whole hour, which was first in a very, very, very long time. And continued treatments helped him additionally. So after that, he improved on a weekly basis, and total he came for 27 treatments, so that was a little bit over 3 months. Um, he he just loved it because about in the middle of treatment, around after 16 treatments, he was started to weight lift, which got him more bulky and stronger, and that was his objective verification that he was doing okay, that he physically saw his body changing and for the better. And he was experiencing almost no pain when he was working out, and he had a good sense of well-being, clarity of the head. He was sleeping well, so he felt like he could move on with his life, especially at the age of 23. So this is highly encouraging. Let's go to the case 2. This is female, age 63. She had a serotonin syndrome. Serotonin syndrome is sudden flooding of serotonin within the brain, and it doesn't get recycled, so it stays in there. The symptoms are cold sweat, dizziness, incoherent speech, difficult to walk, I mentioned cold sweating, and tremors. So she had all those when she came in for acupuncture, and her friend had to help her out, even take off her shoes. When she was lying on the treatment table, she was in a fetal position. After the first acupuncture, she got up on her own, put her shoes back on, she was speaking more clearly, and she had 5 additional treatments. And for her, she had a good response. 6 treatment was enough to get back her brain chemistry almost back to normal. Well, she felt normal. So let's go to the next case. Case 3, male, age 52, acute liver failure from excessive alcohol. This patient overdrank because of sadness that was happening in his life, especially death in his family. So he just drank too much and had an acute liver failure. He admitted himself into a sober living home, and he started seeing me after that. And at that time, he was starting to feel better. His liver was starting to improve because prior to that, he had backup of fluid because the liver was not processing the fluid well enough. And so backup of fluid in his torso and also in his legs. So when I saw him, his legs were quite tight, and he was just full of water. And when you press finger on it, then it would leave a dent. And but at the time, his edema was starting to improve. And after the first acupuncture, his edema improved quicker than before. Along with that, he had chronic neck pain, hip pain, knee pain, and so he saw the holistic effect of acupuncture, which was reduce pain, inflammation, and promote healing. That's why not only lessening of pain, but the extended period of having less pain, indicating his body's taken over. Another indication of his body taking over was that his edema was getting better faster, meaning his liver was recovering faster than before. So acupuncture has many applications, and not everybody fits into this ideal stage. What I call these patients are very high relief patients, but that's about 1/3 of those patients that I treat have this kind of response. The other 1/3 is more of a moderate relief. And so overall, you have a pretty high improvement with the patients, and this is definitely worth trying for those who are struggling with getting off of opiates, benzodiazepine, and SSRIs. I project that acupuncture will be the main means of treatment of withdrawal symptoms due to chemical dependency. I'll speak with you soon.